An advanced nurse practitioner is an experienced nurse who's undergone further training, usually through a master's level course, to take on an extended role of clinical patient assessment. There's elements of research, leadership, education that come along with the role as well. So essentially you would have a nurse by background who is now undertaking some of the roles that would have traditionally been seen as medical. So we work part of a wider medical team. What that means on a day-to-day basis is patients are being assessed by a nurse with these advanced skills in clinical patient assessment. We're making diagnosis, we're making plans for investigations, we're interpreting them, and we're making plans for treatment, and that includes prescribing medications as well. So the benefits for the patients would be quicker assessments sometimes, that they're able to be given more in-depth assessments depending on what their problem is, that we're able to use our nursing skills in assessing what their clinical or psychological needs would be. And we're also meaning that they're not having to go through multiple levels of assessments, that they would be able to be seen by us, investigated, treated, and then either discharged home or referred on as needs be. So it's not having to go through an assessment by a nurse and then an assessment by a doctor. We're able to do all of that role quite autonomously. So the development of these roles mean that you can stay in something clinical, you can do the things that you enjoy, you can learn new skills and expand on your abilities by using your experience in a different way once you've had this training. In nursing now, this has opened up an avenue for people who want to remain in clinical roles while also having some autonomy. That you can make decisions about your practice, that you're not always deferring to somebody else constantly, and because of our abilities now to prescribe, request investigations, to interpret them, you can actually look after a patient autonomously and holistically. You can look after everything that they need. To develop into these roles, or if you were looking for it as a career pathway, you'd be looking at needing to get a good 5 years experience in the speciality that you're working in, just so that you've developed a good knowledge base of your own. There's master's levels advanced clinical practice courses that are now run out of the majority of universities, both in Wales and in England, that would give you the theoretical and the academic knowledge for you to go forward into these roles. But you'd be looking at working within a team that have decided that they want to develop nurses into this speciality, this arena, and then it would be a 3 years master's programme, and alongside that you would have a scope of practice that you would be working to. With advanced practice, we've got a framework that we work to, and there's 4 pillars within that: the clinical, research and audit, education and leadership and management. Some advanced nurse practitioners have quite a specialised scope of practice, albeit that our core skills are transferable and the same. And some nurse practitioners have quite a broad scope of practice, depending on where they work. In emergency medicine, for example, you would have quite a broad scope because you're going to see medical, surgical, trauma type patients rather than just one speciality. So you then negotiate with your supervisor. All of us have got consultants who supervise our practice that we meet with regularly to discuss patients, to make sure that our learning and development is ongoing. We would audit what we're doing, patients that we're seeing. So it's about developing those skills, which you learn then as part of your university course as well.